invite our two speakers up here to take your questions. Well, you guys there's a floor mic here, and if you have questions you want to write down and pass down. I think I've lost Victoria, but Cindy Sutter would love to collect them. I see her in the back there. So just hold them up if you want to send some questions down. Jennifer, we had a question that came in. Does the 504 plan rules apply to charter schools or private schools, colleges?
Section 504 plans apply to schools that receive public funding. So if your child is in a parochial school or a private school that does not receive any public funding, 504 plans, they may have some type of accommodation plan that they'll put in place, but it is not the same as a federal 504 plan that you would put in place in a public school. Charter schools do typically, if it is a public charter school, they receive public funding. So a 504 plan would be applicable and implementable in that case.
If you have a 504 plan in place in one district, can it follow you to another?
Yes, that's one of the great reasons to have a 504 plan is because if you move, that 504 plan will follow you. If you transfer districts, that 504 plan will follow you. They may have a different way that it will look on paper and a different way that they go about the discussion because I'm from Georgia. So we still write out a lot of our 504 plans on paper. We haven't quite caught up yet. But that paper 504 plan would still go with you from district to district.
And this other question was very similar. Can you take it from elementary to junior high to high school within the same district?
Yes, 504 plans are you need to look at them year over year, basically. So it's in place for 12 months. Some schools, you have to stay on top of them depending on your school. Some schools may forget that, oh, it's time for us to do the 504 plan because there's not an automatic trigger like there are with some of the different types of supports. But a 504 plan will stay in place as long as it's necessary for the child from preschool, if there's public funding that goes to the preschool, all the way through college if your child is going to be attending a public university that receives any type of public funding.
Okay. This question's for Dr. Zahka. Can you tell us a little bit about developmental stages and how you communicate with children differently in those developmental stages about their disease? How much information do you give them about their disease, their prognosis, and so on?
I think that's a great question. You know, for younger kids, you want to take a pretty literal, concrete, simple approach. You don't want to overwhelm them with too much information. You know, so something as simple as, when you eat, whatever food, it gives you a tummy ache. So we want to make sure that you stay safe, and so you can't eat whatever food it is. Something kind of that specific. Obviously, that's a bit of an oversimplification, but, and then as kids age, giving them information to some degree as they're looking for it. So I think that idea of how much do you talk about prognosis is a little bit of a challenging one. I think that we can't yet predict the future, so I do tell people to the degree that you can, to be careful about that kind of idea of scare tactics. So it's not actually, you don't want to say if you don't do this, when you're 30, you're going to be in the hospital. That's not a very effective method at all. And in fact, what we found that when we've done research that idea of scare tactics doesn't actually work to help adherence. So I think if you think about, what you would tell a 12 or 13-year-old, giving them more information than you were giving them, when they were younger, so that they're able to learn more about the disease that affects their body, and they're able to take more kind of personal ownership and responsibility over it, and even encouraging them to do some research online to see what they come up with, and what they can begin to understand, so that they have the words and the story to be able to tell people when people ask. So, younger, you start out with really simple information, and then as kids age, adding on information, as appropriate and as kids are asking for it. But I would really, to a great degree, avoid that kind of, sort of negative, if you don't do this now, this is what it'll be like for you in the future.
So for instance, for a grade school child, 6 to 9 or so, how would you explain to them that they have a chronic illness that will be with them possibly lifelong and require severe dietary restrictions? How much information do you give them about that?
I think I think almost exactly that, describing, what sorts of things the child will need to do on a daily basis. So this is a disease that we don't have, we know you're going to have to deal with it every day and it's going to change, and so at different ages you may have to have different tasks, but for right now, these are the things that you need to do each day. These are the foods that are safe to eat. These are the foods that aren't safe to eat, and starting to give a little bit of information about kind of how the body works, and I think adding on for them, kind of the different reactions that their body will have, when certain different foods are, are ingested or not ingested. And I think, to some degree, kids in school age are already figuring out, okay, when I eat this, I get a stomach ache or I get sick, and starting to tell kids why that is, that it's because your body can't tolerate, those ingredients, and so your body has a reaction to it. And I would still, I still tend to take a pretty sort of present-oriented, approach to this. And I think, the important thing too is from a family values perspective, how you talk to your kids about things. And so, I don't have a sort of a specific right or wrong answer on how much to tell versus how little to tell, because that's also family-based and how much you guys choose to tell the kids. But, I do think as kids age, they do need more information. Otherwise, it's this idea of, well, mom keeps telling me to do this and I don't actually understand why. So I would give information until you feel like your child understands some of the logic and some of the choices behind it.
And do you have any recommendations on when a family should seek help, seek a therapist, and does that therapist need to be familiar with chronic illness or eosinophilic diseases for them to be effective?
That is a great question. To some extent, it is when it, certainly if your child is struggling at all. So if there's a significant difficulty with, emotional functioning, always seek out help. I tend to see kids when they come in, to Cincinnati, for example, to do a consultation during new patient diagnoses, just to give an idea of what services there are out there. So I think that, that's helpful in terms of helping families know, oh, okay, we could call you if this happened or if this happened, if, there are difficulties adhering to the diet or whatever it is. Some kids are really resilient and some kids feel like, they can manage this, and that's a temperament thing. And I don't ever think that, you need to force someone into therapy if they feel like they're coping with it okay. And I think that we really need to, positively reinforce the good coping and not say, oh, well, because you have a chronic illness, you must need a therapist, because as we know, chronic illness doesn't directly lead to kind of negative outcomes. So to some extent, because you guys are the experts on your own kids, I bounce that back a little bit to, if you're concerned at all or if you see any changes in your child's kind of daily functioning or temperament or mood seems to change, it's a good time to seek out help. With regard to whether or not it needs to be a psychologist who's trained in chronic illness, some people don't live close by major medical centers, and major medical centers tend to be where the psychologists are who are trained in chronic illness. So I think that it probably helps because you have to do less explaining. But if you find a psychologist close by who you connect with, who your child connects with, you can direct them to resources to learn more about eosinophilic disorders. So I think above and beyond everything else, the relationship that your child has with the provider is most important. If everybody could work with a psychologist who's worked with kids with eosinophilic disorders, that would be great, but not realistic at this point, I think. So it's important, I think, to find a good therapeutic fit.
Sounds like if you find that good fit, you may need to do a little education about how that impacts life. Kind of a similar question relates to the child who feels perhaps guilty for the impact their disease has on the family, is apologizing all the time for having this problem. How do you work with that child? Is that a sign they might need some help?
Yeah, I think that is, a good time to seek out a psychologist. And I think, for the reason also that you guys as parents can't do everything. And so sometimes it's nice to have another person come in and talk to the child and say, to kind of talk them through it a little bit and help them reduce the anxiety that goes along with the fact that they feel bad that mom has to take a lot of time off work or that dad's working extra hours, to cover bills and things like that. Kids are pretty perceptive, so they tend to really absorb, a lot of the stress that goes on at home, even if we think we're protecting them from it. And so I think if kids are starting to express that, then it's clearly something that's troubling them. And I do think that that's a good time to seek out a psychologist, because to some degree, you're probably already reassuring the child that they have nothing to feel guilty about, but it may be that you need that other person to kind of come in and help the child deal with that internally as well.
This is a couple of school-related questions. Do the parents have a right to request basically an allergen-free classroom? And how do you deal with that, especially airborne allergens?
You can request anything you want to. Never hurts to ask. If you make a request, it is important that any response that you get that is not in your favor is provided to you in writing. That's just basic parental right under federal law. And they need to outline to you what the rationale is behind it. Typically, schools are reluctant to implement accommodations that will impact a larger group of students. Sometimes the schools are very good about providing an allergen-free specific setting. Other times, it's just not within the budgetary or the resource abilities that they have to do that. So you can certainly ask. But if they say no, the answer would be, then what is your plan to keep my child safe?
And a kind of a follow-up question to that is, what do you do at the beginning of the school year? Should you notify the class parents, the teachers, send out an email to all the parents in the class about the child's problem? How do you deal with that? And I can share our personal experience. We have always shared the first few days of school. My son and I would sit down and educate the class and the teachers and the room parents about his illness, and he eventually got old enough he could do this himself. It took the mystery out, and everybody, it wasn't that interesting after that, But I did find that once we did that, we would get emails. The parents were worried about sending the wrong food to school and say, don't worry, he knows what he can eat, it's okay. But what do you recommend to parents about that? And if there's anyone who has suggestions as well, come up to the mic and share.
Well, I think it kind of goes along with what she said about it. That's kind of a personal decision how you want to handle it. At the end of the day, it is the teacher's responsibility to implement any supports that are put in place by the school. But I also feel like it's important to teach your child self-advocacy. I talked about that in my presentation. And the best way to do that is by helping empower him or her through your own example of how you address, this is the situation, this is what we need to do to help keep the child safe. My personal recommendation based on my own personal experience is much what Wendy said, which is be open about it from the beginning, let them know what's going on, and then other parents will feel more free to ask questions of you. My child is gluten-free. And so we did the same thing. When he went gluten-free, I sent an email out to all the teachers in his class, or all the parents in his class. Then they were free to contact me. Well, we're going to have a class party. What can he not have, et cetera. So I believe very strongly in transparency. It's a personal philosophy of mine. I think that the more open and honest you are about things, the better it fosters that self-advocacy that's so critical for your children.
And I think I agree completely. And I think in addition, it also fosters that it's not something to be embarrassed about, and being able to talk about it openly, talk to teachers, and have other parents be able to ask questions. It's not a secret, and it's not something that the kids have to be embarrassed or ashamed about, but it just is.
Mm-hmm. Mm-hmm. And that's typically the way we presented it. It is what it is, and you're going to see them doing these feeds in the classroom, and the kids got their staring over with the first day, and then they were done. And Ryan would always just say, Mom, I just stare right back at him. It doesn't bother me. So, Julie, you have some suggestions?
I deal with I have a 12-year-old with contact life-threatening food allergies who has attended school since she's been 3 years old. I have a entering second grader who has a G-tube and does her own bolus feeds at school on her own. And then I have a going into 5th grader who is EOE also, who though has an elimination diet. And my general philosophy has always been, if my kids can get to school, anybody's kids can get to school. We have done everything to wiping hands when kids enter the classroom, you know, till not needing that when the child ages out. But I always know who my teachers are before the school year is out for the following year. We always have our meeting in the spring before school is out, a quick FYI session so that the teachers are aware of what they're getting into in the fall and they're prepared, especially if they're planning lesson plans with food. We have a history teacher who thinks she can't teach any century without eating the food they ate in that century. And so if they have to change a lesson plan, they have time. And I request the meeting in writing, and attached is the same doctor letter every year, you know, with a date changed. And then, you know, we have a general plan. They have time to think about it all summer. And then in the fall, we meet again right before school starts. And you know, they're always not very quick about assigning the teacher, but I'll be like, we need to know, you know, follow up with the letter. The book that Jennifer talks about, I cannot tell you enough that Wright's Law book, everybody who is a kid in school should go home and buy that because everything she's saying is in it, and it's an amazing book. And the number one error that we make as parents, and I can't say that enough, is that we are too emotional and do not treat our interaction with the school district as a business interaction. And as cold as that may sound, you cannot get your kid into school and properly advocate for your child through your heart. It does not work. It has to be your brain, and it has to be professional, calm, and then get in the car and cry and freak out. But it's how you handle it. In the professional business transaction is the only way. They don't want to hear, you know, that your kid and you being upset and crying and how often they puke. They just want to know what the disease is, what are the problems. And the biggest thing I like to say is it's about convincing them that it was their idea. Instead of saying you have to do this, to say, this is the problem, these are 3 solutions, get back with me in this time frame, and let me know what your idea is, you know, what will work for you. And then when they do it, you're like, great, that's a wonderful idea, you know, and it's getting them to buy into it. Making demands and being upset doesn't accomplish anything. And I have not always had an easy time, but I use the imagery of Teflon, that you have Teflon, and no matter how hard it is. I mean, my kids have been denied entry into preschools that were private, and it's not always been easy. But again, leading from the brain and not the heart when it comes to getting your kid in school is probably the best advice that I can give you.
Very, very good point. This is the problem. How are we going to solve it? Definitely. Our speakers need to run to the airport, so just a couple of last quick questions. One of the common problems that comes up is dealing with family and friends. They don't get it. How do you explain to family members and friends and help them understand the psychosocial impact the disease has on the whole family?
I think that is, I wish I had an easy answer to that question for you. I think that part of that comes from experience, and part of it is also, continuing to explain it in a way that is fact-based as much as possible, and trying as much as you can, much like communicating with schools, to take some of the emotionality out of it. Because I think that, it likely feels pretty hard if you're trying to explain to your best friend or, your sister or your parents or your favorite aunt, if you're trying to explain, what an eosinophilic disorder is and what dietary restrictions it requires and the importance of all of this, and you're not getting that empathy and you're not getting the understanding, and it doesn't feel like, that other person is also understanding the impact of this for the family. So I think, the important thing is, as much as you can, almost kind of planning out what you're going to say, almost sitting down and kind of jotting notes and thinking about what are the important things that I want to make sure that I communicate? And what are the things that aren't necessary now, but maybe once this person or once this group has that foundation, that then, we can start to add some of these things in. And I look at it just like, I mentioned when I first started my talk that I'm a psychologist. I don't have any children with eosinophilic disorders, and the injustice that I felt when, I was trying to explain this conference and why I was here, it made me want to sort of rail against all of these psychologists and say, hey, wait, you have to listen. So if that's what it was like for me, I imagine the power and the intensity of the emotion for you guys as parents is infinity-fold times what my experience was. So I think, as much as you can, taking a practical, informational approach, sitting down, preparing what you're going to say, making sure that it's not happening a day before Thanksgiving, that it's happening, on some random day in April, when there's no family holidays coming up, and just saying, hey, can I tell you a little bit about, what this is like? Inviting families, and friends to go to websites, come to conferences, go to walks, and to really just kind of learn more about, what this disorder is like and what the experience is like.
Mm-hmm. And similarly, what do you do when you have disconnect between spouses about management and the discord in the family? That's a tough one, isn't it?
That's also a really tricky question. I think first step is making sure as much as possible that both partners are involved in medical visits. So lots of times moms are the ones that are taking the kids to the doctor's appointments. Not 100% of the time, but certainly a lot of the time. Moms are the ones that are taking the kids to the psychology visits, and so I think that it's important that, both caregivers, and when I say both caregivers, it may be, it may be a spouse, it may be a grandparent, it may be a close family friend, that both people are at the doctor's visits, are getting the information, are able to kind of be on the same page just about the medical information, so that you have a fighting chance when you're at home to be on the same page about how to manage it. And certainly if it continues to be a struggle, this is what psychologists and therapists exist for. Go see a family counselor, go see a psychologist, go see a couples therapist to say, we need a couple sessions on how to talk about this and how to best help our child. Because ultimately, what both parents want is for their children to be safe and healthy. And sometimes I think that, when one parent goes to all the doctor's visits and when one parent holds most of that information, the other parent is sometimes maybe struggling a little bit with some anxiety about, well, what if I mess it up? You're so good at it, you do it. I'm just going to let you do it. And I think that, that can get misread sometimes as not caring, when really it's, a fair amount of anxiety about something going wrong.
Mm-hmm. And I'm impressed with the number of men we have here this year. I'm just noticing as you're talking. How many of you are dads versus patients, or both, I guess, is possible? Okay. Yeah, all right. There was a time when this room at the conference was filled almost entirely only with women, and it was rare to have the dads come. So thank you all for being here. We appreciate that. Last question for Jennifer. If you have a child who's on Homebound because of chronic illness, do they qualify for an IEP? Do you need anything special in place for that child on Homebound?
That's a loaded question. If the Homebound is being provided through the school, then if there are academic deficits, or if there's an educational impact, social, emotional, behavioral development, or academic deficits, then an IEP would be applicable. An IEP would not apply just because of lack of social interaction. It would have to do more with what is the social development for that child at that age. So I hope that answers the question.
Okay. All right. Well, I want to thank you both very much for being here today. It was very, very helpful. Thank you.